So, because we're recording, I'm just going to read my disclaimer here before we get going. Participation in this presentation does not constitute an endorsement by Social Security Administration or its employees of the organizations and information and products not provided by SSA. I am going to switch my camera off just during the presentation. I'll pop back on during the Q&A just for bandwidth purposes. Before I get going, I just want to give you a little background on me. I'm a public affairs specialist with Social Security. I've been with the agency for over 20 years and in the public affairs position for 8. I am actually located in Peru, Illinois. If you're not familiar with Peru, if you've heard of Starved Rock State Park, I'm about 10 minutes from there. And I cover 17 offices in northern and north central Illinois. So a big amount of the suburbs are covered within my area. And I'm just going to go over mostly retirement and related programs today, go through a quick overview. And then I'm going to hop on our website live when I'm done with that to show you some important information on some updates we've had at Social Security. So just to start with some basics as far as how you qualify for a retirement benefit with Social Security, when you work and you pay into your FICA taxes with Social Security, which most of us do, you are funding the current Social Security trust funds and you are providing for your future Social Security payment. So to get a Social Security retirement benefit, you just need 40 credits. Many of us will have these within 10 years of work because you can get up to 4 a year. Now, back when we used to send the paper statements out every year, I got mine when I was like 26 and I already had my 40 credits because I had been working, part-time jobs, summer jobs, things like that, in just a few years at full-time employment. But you only need, even in 2025, $7,240 to get your 4 credits. So it doesn't take a lot to get the minimum eligible for your Social Security benefit. And you could get, one a year for 40 years and still be eligible. As long as you get to 40, you're going to be eligible for some sort of retirement benefit. And of course, the more you pay in, that's going to determine your payment amount. And that's why everyone's benefits are different. And how we determine your benefit amount. So when I got that estimate when I was 26, it wasn't very high, what I would get at retirement, at 62 minimum age for retirement. But as I continue to work, that benefit estimate keeps increasing. So what we do, or the computer does, don't worry, I don't have to sit with a calculator and do this, is I take your wages and adjust for inflation. So adjust them for wage levels over time. Then we find the monthly average of your 35 highest years of earnings. We get your average index monthly earnings from that, and we apply a formula to it. So that's how you get what your monthly benefit estimate is. Sometimes people will contact us and they'll say, well, when should I start my check? What's the best age to start my check? And we can't really tell you exactly when to start your benefit because there's a lot of factors. So your answer could be different than your spouse's or your siblings or your best friends. Again, the earliest you can draw is 62. That's still early retirement age. Full retirement age has been increasing, so we're going to talk about that in a moment. But you can see from this example, the person's full retirement age is 67. In the example, the person, if they draw it at 62, they're due $1,400 a month. Every single month you wait, it keeps increasing. And then if you get up to 67, they would be at $2,000 a month. If they wait to take it till 67, because once you take it reduced, you keep that permanent age-related reduction. And then between 67 or whatever your full retirement age is and age 70, you earn delayed retirement credits if you continue to wait. So I can tell you, you can't get your retirement before 62, and you don't want to wait past 70 because at that point you're just losing out on money. In between there, you can see that benefit went up over $1,000 per month. But the person who took it at 62 was received 8 years of checks before the person, if they had waited till 70. So that's quite a bit of money they've received. It might end up being, 15, 20 years till it was no longer advantageous to have taken it early when you consider all that money they got up front. So sometimes what people will think about is longevity in their family. Does everyone live to 100, or do they want to take it earlier just in case? If you're still working, which we'll talk about, do you need to work till 65 for Medicare? Because that's the earliest you can get that based on age. What are your other investments, retirement goals, things like that. So those are all things that are going to impact a decision that are outside of the factors that Social Security can, factor in for you. So here's the chart where you can find your full retirement age. So everyone born 1960 or later, including myself, our full retirement age is 67. We are still in that middle ground, kind of, where people might be at 66 and 8 months, 66 and 10 months that are contacting us to file for their full retirement ages. And of course, the higher the full retirement age goes, the more the reduction is at age 62. So if I go ahead and take it at 62, I would receive a 30% reduction. But again, that might be my decision, just to, consider having my money and taking it as early as possible. One factor, though, would be if you're still working, that plays a lot into the decision on early retirement decision. So these figures are as of 2025. And always, if you're watching the recording, today is May 13th, 2025. So everything is up to date as of right now. If you're watching it at a future date, you always want to go to ssa.gov for current figures. Generally, though, these are going to stay the same throughout the calendar year, things like our earnings limits and things like that. So this year in 2025, if you're under the year you turn your full retirement age, you can make $23,400 and still receive all of your Social Security checks. If you should go over that, we're going to hold $1 for every 2 you are over that limit. So how this works is when you file, we ask you for an estimate of your earnings. And then if you're over the limit, we'll hold checks in work suspense. So let's say, to make it easy, you are $20,000 over this limit. You turned 62 last month in April. You have to be 62 an entire month to be eligible for a check. So May would be your first month you're eligible, and you file or contact us about filing this month, and you say, I want to go ahead and get my check started and making that 43,400. So we would take half of that 20,000 because we hold $1 for every 2, so we're at $10,000. And we need to hold that amount of Social Security checks before we pay you. So if your monthly benefit is $2,000 a month, we're going to hold 5 benefit checks. So in that scenario, we're going to hold May, June, July, August, and September. You would be due your first check with October paid in November. And then we would restart this process again the following year based on that earnings limit, because you're still going to be under your full retirement age. Now, what will happen is every month you take it before your full retirement age, that's called a reduction factor month. And so you would have the full amount of reduction factors if you took it at 62, but at your full retirement age, any checks that we held for your earnings, so those 5 checks we held, for instance, for 2025, you're going to get your benefit recalculated, almost like you took it 5 months later. So it'll get rid of those age-related reductions for those 5 months. But again, that doesn't happen till full retirement age. So depending on how much you're making, you might say, well, I'm going to go ahead and wait because, I'm not going to be due that many checks and let my benefits keep growing and take it later. Or again, you could go ahead and take it and we'll hold those 5 checks in that example up front. Now, you can see also, though, that there is a monthly figure right under that. So the year you file, we have 2 different work tests we can use. We can use the yearly that we just discussed, or we can use the monthly. That's always just the yearly divided by 12. So let's say a different scenario is that you're over 62, but under the year of your full retirement age, and you have been working full time this year. And you've been working from January through May, and you're going to retire at the end of this month. But you've made $80,000 between January and May. And so you might say, oh, well, I can't take my benefits because Megan said that earnings limit is 23,400. I won't be due any checks, based on that. But then in that scenario, since you're retiring from your job, you're stopping work, you can actually start your checks with June, paid in July, as long as you're under the monthly limit for every single month for the rest of the year. So June, July, August, all the way through December, you have to be under that 1950. But then in that situation, it does not matter how much you made while you were still working. Now you can see same basic premise the year you turn your full retirement age, but quite a bit higher of an earnings limit at 62,160, when we only hold a dollar for every three. Then, so that's going to be between January and the month before your full retirement age, the first day of the month in which you hit your full retirement age. So my birthday is July 21st. When I turn 67, July 1st of that year, I can work and make as much as I want and still receive all my Social Security checks. There's no limit on your work once you hit full retirement age. So before I move completely off the work limits, I do want to mention that those work limits we just went over also apply to anyone else receiving benefits on the record. So those are the categories we're going to talk about now. So your children, spouses, former spouses, survivors, those all still have that same work limit. Whenever you file an application, whether you file online, which is the easiest way to get it done, or whether you file over a phone appointment, we're going to ask questions about other people that might be entitled to benefits. So this first category will say, do you have any children? If they must be unmarried, under age 18, or maybe they're finishing up their senior year of high school. They turned 18, but they're still in high school. As a full-time student, we can continue to pay through the end of the school year or up until 19, or 18 or older and having a disability that began before age 22. So that last category you kind of want to think about. Maybe you have an adult child with a disabling condition they've had since birth, and they were 35, 40 years old when you go to file for retirement. Make sure you remember to list them if they're unmarried and they haven't been working substantially or not on their own record, and we will screen them for the disabled adult child benefits. So whenever you list people on your application, it protects them, and whoever gets assigned your application, so even if you do it online, it does get reviewed by a person, they will follow up about those other potential benefits for others in your household or others you listed. Now, this first category of benefits for spouses we're going to talk about is someone you're currently married to. So the first thing to know about somebody you're currently married to, spousal benefits, is that you or your spouse cannot receive anything as a spousal benefit until both of you are either filing or receiving a benefit. So, and then if you both have your own work history, both have your own 40 credits, we always look at your own benefit first before we look at anything additional off a spouse's benefit. Vice versa, if you're the higher wage earner, we're going to look at your spouse's own benefit before looking at a spouse benefit off yours. So we're going to look at 100% of your own benefit. So even if you're filing at 62, this is your full retirement age rate. We're going to look at 100% of that. We're going to look at your spouse's 50% of their full retirement age rate. If 100% of your own is more than 50% of your spouse's, there's no spousal benefit payable. And that's going to be a somewhat common situation with oftentimes both members of a couple being in the workforce. But if it's less, then we're going to pay you what we can on your own, and then the difference between 100% of your own and 50% of the spouse's off of their record. And then if filing early before full retirement age, we're going to apply that age-related reduction. So to get a spouse's benefit, again, you both have to be filing or receiving. You need to be at least 62 to get a spouse's benefit, unless caring for a child who is under 16 or has a disability. So otherwise, you're just same age as retirement for spouses benefits. Now, anytime we pay a benefit to a child, a spouse, a former spouse of a record, it never reduces the payment for the worker themselves. So let's say I'm married and my full retirement age rate is $3,000 a month, and my spouse's full retirement age rate is $2,000 a month. Well, nothing's going to be paid as a spousal benefit to anyone because we're both just going to be receiving off our own. But if mine's 3,000 and my spouse's is 1,000, then they would be eligible for up to $500 off my record because they can get up to 50% of mine, and that is more than 100% of theirs. So we're always going to check this out for you. We always look through the application to see who would be eligible for benefits. Next category, divorce spouses. So there's some similarities and there's some differences when it comes to divorce spouse benefits. For divorce spouse benefits, the marriage has to last at least 10 years and you cannot be currently remarried to anyone else. You have to be age 62 or older. And again, we're going to look at your own benefit before looking at anything off a former spouse. The one big difference with divorce spouse benefits is that your spouse does not have, your ex-spouse does not have to be receiving the benefit yet, like in the case of a current spouse. They just have to be eligible to receive that benefit, meaning they're at least age 62, or they're on retirement or disability, but they don't have to be collecting. And that's the big difference with those benefits. And then our final category of money benefits we're going to talk about is survivors benefits. Now, rules for children are the same, under 18, still in high school, disabled before age 22. But for surviving spouses or surviving divorced spouses, there are some differences when it comes to survivors benefits. So you can begin these benefits as early as age 60. So this is the earliest age-related benefit you can get. As a survivor's benefit, or as early as age 50 if you have a disability, or again, any age of caring for a child of a worker and the child is under 16 or has a disability. So those are the criteria for survivors benefits. Another thing to note about survivors is that you can remarry after age 60 and still keep your eligibility survivors benefits. And then with survivor, percentage of benefit we pay is higher of the worker's record because the worker's not receiving their own anymore. You are eligible for more off the record. So age 60, you're going to be reduced, of course, because you're filing early. So it'd be about 71.5% of the worker's full retirement age benefit. Each month you wait, just like your own, it's going to increase up to 100% at full retirement age. So that's when the unreduced benefit again would happen. And that's when you get the full benefit amount if you wait until full retirement age. So just to cover the differences again between getting a benefit off of someone who's living, a spouse or former spouse, versus getting off a spouse or former spouse who has passed away. Off someone who's living, you can't start till 62 unless you have that child in care, and it's going to be 50% or less of their benefit. If they've passed away, you're looking at age 60 or 50 if disabled, 71.5 to 100% of their benefit. So there are a lot of situations where someone might not have been eligible for a spouse benefit, but if the higher earner passes away first, you then need to contact us to file for the survivor's benefit so you can get that higher benefit check. Now, we talked about with spouses and divorced spouses benefits that you always have to take your own benefit first. This is a policy called deemed filing that came into law several years ago now. That does not apply to survivors benefits. So if you know you're eligible for survivors benefits prior to filing, you do have some strategies you can use. So you could take your survivors benefit as early as age 60 and then switch to your own record as early as 62 if you want, if it's higher, or you can keep letting your own grow till age 70. A lot of people go with that option. Or you could take your retirement benefit as early as 62 and switch to the survivor benefits later. Now, with survivor's benefits, those do max out at full retirement age, so you want to switch over. They don't increase all the way to 70 for those benefits. And something kind of newer that we've been bringing into our presentations is just touching quickly on benefits from a grandparent. There are increasing amounts of grandparents raising grandchildren, so we get some questions about that. So just so you know, um, if you have a dependent grandchild or step grandchild, you they might be eligible for benefits off your record as a grandparent if their adoptive parents are deceased or have a disability, if the grandchild was legally adopted by the grandparent. So a lot of grandparents might have legal guardianship, but for this you need legally adopt and the grandchild must have lived with the grandparent in the United States before 18 and received at least one half of their support from the grandparent throughout the entire year before the month in which the grandparent either becomes entitled to benefits or passes away. So that's, the quick review on the money benefits we pay out, surrounding retirement. We also do at Social Security enrollment of Medicare Part A and B, and that's all we do with Medicare. So anything else related to Medicare, we always recommend that you work with a SHIP counselor that's trained through Department on Aging, because they can help you with prescription drugs, supplements, Medicare, what they cover, all those sorts of things. But I can cover the basics for you. So like I said, we do enrollment in Part A and Part B. Part A is your inpatient hospital. So you're overnight or longer in the hospital. If you have 40 credits from your own or a spouse or former spouse's record, you do not pay anything monthly for the Part A. The Part B, medical insurance, that's going to cover outpatient visits, outpatient procedures, certain medical supplies. It even covers the part that of the doctor seeing you if in the hospital.
To set up if she wants to come.
And then
we have.
and if everyone could just make sure you're on mute. Yeah. And so again, that's going to cover pretty much everything else related to seeing a doctor and, like I said, certain medical supplies. You can always go to Medicare.gov also if you are internet proficient, and you can look up all the information there. And this is a good time just to mention, always make sure you're on .gov when you go to Social Security, which is SSA.gov or Medicare.gov or IRS.gov. Make sure you have that .gov so you're on the correct site. Now, in addition to regular Part A and Part B that we do, then, like I said, you can go on to Medicare site, or you can work with a SHIP counselor to add a Part D prescription drug plan. And you can look into supplemental, or as people call it, Medigap insurance. Part B, Part A and Part B both have deductibles. And then with Part B, Medicare generally covers 80% of approved charges. So some people like supplements to kind of fill in the gap of that 20%. Or you can look at a Medicare Advantage plan, also known as Part C of Medicare. So with the Medicare Advantage plan, you're still going to enroll with Medicare with Social Security in the A and the B. But then once you're in that Advantage plan, all your billing questions, things like that, are going to go through that Advantage plan rather than Medicare directly. Now, some people like these plans because they have usually the Part D plan right alongside figured out for you. And they might have benefits like vision, hearing, dental that traditional Medicare does not cover very well, and can lead to also lower out-of-pocket costs. Now, as far as when you can go on to Medicare, the big time you're thinking about it is age 65. That's the earliest you can go on Medicare based on age. Even if you take your retirement at 62 or survivors at 60, you can't get the Medicare until 65. But we also have Medicare for individuals who are on Social Security disability for 24 months, or individuals who are found disabled with ALS. They no longer have that 24 months. It starts right away. We also have a specific policy. It's called end-stage renal disease for individuals who are on dialysis or transplant. And that's a very specific type of coverage that the dialysis center usually connects people with our office. For age 65, your first opportunity to get into Medicare is called your initial enrollment period. Now, if you are receiving a monthly Social Security check or applying for a monthly Social Security check within 3 months of turning 65, you are um, going to be automatically enrolled. If you're on Social Security prior to 65 and getting a monthly check, you're going to be automatically enrolled in A and B. Now, you may or may not want to keep the B, but you have to have the Part A if you get a monthly Social Security check by law. But if you are not receiving, and I should also mention that card comes in the mail about 3 to 4 months before your birthdays if you get auto-enrolled. So do make sure to open all your mail carefully, because a lot of people accidentally throw them away because it comes in kind of a plain white envelope with a little bird in the corner. But if you're not on benefits yet, there's nothing magical that happens to put you into Medicare. So if you do need it at age 65, you need to make sure you enroll during your initial enrollment period. So that's the 3 months before you turn 65, the month of your 65th birthday, and the 3 months after you turn 65. If you want it the first day of the month in which you're 65, though, you need to do it in the 3 months before your birthday. If you wait till the month of or the 3 months after, the coverage will begin a month after enrollment. So that's your first opportunity. Now, not everyone needs to get into Medicare, especially the Part B, and that is if you qualify for a special enrollment period. So again, if you're on monthly benefits, you're going to have the Part A. But if you're not, you can apply for Part A and wait on the Part B if you're eligible for the special enrollment period, or you don't even have to apply for Part A. Like for instance, if you have a health savings account, then most people will wait to apply because the HSA, the Medicare can interfere with the HSA. But if you are still working and covered under a group health plan based on your employment or your spouse's current employment, so that's the key. So, like I'm working, I have insurance through my job here at Social Security. If I was 65 now, I wouldn't need to take the Medicare because I would qualify for that special enrollment period. We do always recommend that you check in with your benefit specialist coming up on age 65, just to make sure, our HR, that there's no reason your employer wants you to get into Medicare. But otherwise, you can wait on that Medicare. And again, if it's current employment and a group health plan through that current employer. So this does not include marketplace, VA, retiree insurance, things like that. So it does need to be that very specifically current employment. Do check in on this when you're coming up on 65 just to be sure. So if with the special enrollment period, you're going to have 8 months total following when the employment ends to get into Medicare and have no penalty for the Part B. Part A and B. If not, though, if you don't have that coverage, say you turn 65 and you're like, you know what, I don't want to pay that Part B premium because, I never get sick. And the base premium this year is $185. So you just don't take the coverage at 65. In that situation, which you're going to get a lot of things in the mail coming up on age 65 that talk about penalties, just ignore that if you know you have that special enrollment period. That applies to people who get in during the general enrollment period. So that individual who, maybe at 65, they said, I don't want to pay that. And then a few years down the road, they start having a lot of health concerns. They need to get into the Medicare at that time. You can only get in otherwise without a special enrollment period one time a year. Between January and March, your coverage will begin the month after enrollment, and you'll have a 10% penalty onto the monthly premium for every year you did not take the coverage. So it's really important to do your research coming up on your 65th birthday. And like I said, with the general enrollment period, or if you wait past age 65, but still in the initial enrollment period, the coverage begins a month after. But I did want to drill into when the coverage begins with special enrollment period, because it is a little more specific. So if you enroll in the month that you are still employed, or in the first month after employment ends, you can say, let's say, we're already at May 13th and you stopped working last month. You can say, I want my coverage to backdate to May 1st, or you could choose any of the following 3 months. So you could choose June, July, or August. But if you waited till next month or any of the following months, 7 months of the special enrollment period, the coverage would begin the first day of the month after you sign up. So that's just another thing to note with that special enrollment period. You can get Medicare if say you're not ready to start your checks, you want to wait till 67 or 70 for your checks, but you need that Medicare at 65. You can apply for Medicare only online, or if you're on the Part A already, you just need to add that Part B for your special enrollment period. You can get those forms online. Sometimes you can even submit them online. It is a little more accurate usually to get the paper forms, just because sometimes people have trouble getting the evidence we need when they submit them online, in lieu of the form, because we need two things for that special enrollment period when you already have Part A. We need the CMS 40B. That's the one you say, I'm ready for my Part B to begin. And the CMS L564, that's the one you or your spouse's employer completes, verifying you've had coverage every month since turning 65, so you get that special enrollment period and avoid penalties. So if you do not do them online, you can either mail, fax, or drop off those forms at a local office. All local offices have a drop box, so you don't have to worry about waiting in line. You could even put those forms in the drop box. And again, as I mentioned, Medicare.gov is where you can go either, work with a SHIP counselor through Department on Aging, or go to Medicare.gov, or they have a 1-800 number, and you can do plan finders. You can create a personalized account, contact Medicare, all sorts of things from within the Medicare.gov account. So the base premium this year is $185 a month, but some individuals do pay more for their Part B premium. They pay an additional charge called IRMA, or Income Related Monthly Adjustment. So you can see that depending on your modified adjust gross income, you could be in these different additional premiums on your Part B as well as your Part D plan. So in that situation, it's always defaulting to going off 2 years prior modified adjust gross income. And everything goes into that, investments, sale of a home, things like that. They're all going to go into that. So we're using 2023s right now. Now, it's really important to open your mail, read through it carefully if you're in this situation, because your letter that explains if you're having this IRMA charge is also going to give you some options where we maybe could use a different tax year. And that's if you have a life-changing event. So it'll talk about, we have this form, it'll give you the form number in the letter, SSA 44. It's also available online, just like the Medicare forms. And you can complete that and turn it in if you have one of the life-changing events. And I'm not going to read through all of them with you, but they're all very nicely listed in the letter, as well as the documentation we need for each life-changing event. But one common one I just want to touch on is work stoppage, or you decrease work because of retirement. So that's pretty common at this age. So let's say you retired at the end of last year, and you say, well, I got this letter about this additional charge and my income is nowhere near what it used to be because I retired from work. You do have the option to fill out that life-changing event, get us the documentation about your work stopping. And in that situation, you could ask us to use an estimate of 2025's modified adjust gross income. If you stopped working at the end of 2023, you could provide us 2024's modified adjust gross income. But again, you want to let us know about this right away, because you're protected to get this, life-changing event with the date we get the form submitted. And that's the date it'll change with. So we can't retroactively go back and remove previous IRMA charges. So you want to make sure to get that to us right away. As far as how you file for benefits we talked about today, like I said earlier, retirement, spouses, disability, Medicare only, those are all available online. That is the easiest way to get it done. Let's say you were at least 62, but over full retirement age. And yes, you're retiring from work, but it's not because you're really, excited and ready to retire. It's because you have a disabling condition preventing you from working. In that situation, you can file for both retirement and disability at the same time if you'd like. If you need the money right away from retirement, You can do that, and disability decisions take anywhere from 6 to 12 months. So you'd have the retirement check, but if you get awarded the disability, that's kind of like getting your benefit at full retirement age. So it would be a higher amount. And so that case, you can do those both at the same time online. The only thing not available online that we talked about today is survivors applications. So in that situation, you need to call our 800 number and schedule a phone appointment. That's 800-772-1213, open 8 a.m. to 7 p.m. Monday through Friday. I'm going to show you a little trick about the 800 number when I move to showing you some stuff on the website. Most of the appointments are going to be done over the phone. There's a lot of reasons for that, but one of which is some offices' calendars are more booked than others, or they might not have any available appointments when you call to schedule. So you're on a wait list for, an appointment a few months down the road. But when we do have the phone appointments scheduled, sometimes we can move appointments around to other offices who have more room in their calendar. So that's one of the reasons we like to keep them on the phone whenever possible. But if you have a barrier to phone service, you can also call and ask for an in-office appointment. And this is our ssa.gov website, and I'm going to show you some stuff in a minute. So just right now, just take that page in so you kind of see what it looks like to make sure you're always on the right page when you go to find us. Also, we encourage everyone over the age of 18 to create an online My Social Security account. There's a lot of great features to this, and if you have a login.gov or id.me account already, you'll be able to log in with that and then link your My Social Security with an activation code. If you do not already have an account, it's going to ask you to create either login.gov or id.me. If you go through our option to create an account, it's going to take you through login.gov. Now, I have heard from others, though, some people have more success with id.me versus login.gov. Either works, but ours is contracted through login.gov. Now, some people are going to get the activation code sent right to them via text. Other people have to wait for the activation code to arrive in the mail. But either way, once you get the code, then you can complete setup. If you do not receive benefits, why should someone who's 18 get one of these accounts? Well, the biggest reason is we want you to review your earnings record once a year to make sure everything is posted correctly. You don't want to find out, we're missing earnings from 20 years ago when you go to file for a retirement benefit. So you're going to review carefully your earnings, just make sure they're posted correctly every year. If they're not, if they're missing, you could get us a W-2 to get those fixed up. So that's already done when you go to file. You can also get all your estimates for retirement, disability, potential spouses benefits for your spouse, survivors benefits if you should pass away for your family, and all those things. If you're filing, you can get the status of your application or an appeal. Also, if you have a valid driver's license or state ID, and you can file for a replacement Social Security card online. So if you're not changing name or updating any other information with us, you can do that completely online and the card will come in the mail, saves you a visit to the office. Even if you can't finish a Social Security card application completely online, maybe it's for a child you can't do an online account for, there is an online application you can still do through our website, and it will allow you, once you get to the end, to schedule an appointment online with your local office to take in your documents and complete the application. So anyone pretty much can use that tool online. Now, once you're on benefits, a lot more you can do in the online account. If you're on disability, you can report your wages, you can change address, direct deposit, submit for a new Medicare card, get a replacement 1099. And then a lot of people will come to us and say, I need my award letter or I need my proof of income. We call that a benefit verification. Certain agencies will ask for that from time to time. You can print that right online through your online account. Again, saving a visit to the office or waiting for it to come in the mail. And within your online account, you'll also see your Social Security statement like we used to send out every year. Now, a lot of times I know like financial planners might ask you to bring this statement to their office so you can print it. You can save it to your computer if you're on your personal computer from your online account, or print it, or whatever you'd like to do if you need that statement. And before I switch to our website live, last thing I just want to touch on is scams. We're still hearing reports of people calling, pretending to be from Social Security. And it's not just phone scams, they're calls, it's text messages, emails, all those sorts of things. So let's say that you get an email about an update to your My Social Security account, which we do send out from time to time. If you're not sure, don't click on the link in it. Just go to ssa.gov and log into your account there to check. Never click on the text message links or anything like that if you're not sure. If someone calls you, just know that we never threaten you, suspend your Social Security number, or demand immediate payment from you. Especially, we don't require payment by cash, gift cards, prepaid debit cards, anything like that. Sometimes people do have overpayments. You will be notified about it. There will be a valid site you can pay online. I think it's like pay.gov for those overpayments, or you can submit payment to directly to our overpayment processing center, or to your local office, and they will give you a receipt. We are on social media if you have an interest in following us there. And then I'm just going to switch sharing. Well, let's show you some information from our website, because we have a lot of changes happening, and this is how you can keep up with the changes. The best is by going to ssa.gov. So let me get that open. Okay, so here we are on our home page. Now, up here at the top, it'll have our kind of hot topics always. So, one of the things that has changed this year is most offices have switched to what we call appointment focused service. So, for most types of business, they are going to require an appointment instead of just walking in, even if it's just for something quick. So, again, if it's for a Social Security card, I'm going to show you that. You can go to this number and card and um, go to the online application. So you can, I'm just going to go to this one number for the first time, as it takes you right to that application. But it'll have a tool that it'll walk you through whether you could do it online or not. And then if not able to do it online, it's going to take you to the application. You'll submit it, and then that's the only appointment you can schedule online, but it'll give you an option to schedule that appointment online for your local office. But otherwise, again, we're going to have right from this main page, you can click on if you need an office schedule, and it's telling you what you need to schedule appointments for. It will sometimes give you your local office phone number. A lot of times it's going to give you the 800 number, even though on the site, because the local offices just don't have the capacity to answer the phones. And it's also just double checking, can you do this online without calling or coming in? Another thing that's been a lot on social media, in the news, with a lot of misinformation alongside of it, is changes in needing to provide your identity. So there was, I think it was around March, where it started to be a lot of information about needing to provide proof of your identity. And there was some confusion, and we have a lot of people coming to the office with a photo ID just to prove who they are. You do not need to do that in most situations. So this is a really nice page that walks you through a lot of the frequently asked questions. And one of them, do I need to visit a Social Security office to prove my identity? Does everyone need to prove identity with Social Security? So let's go to that one. If you're not applying for benefits or changing direct deposit information for current benefits, there's no need to contact Social Security to prove your identity. So that is not needed. If changing direct deposit when you're on benefits, you need to, if you're not able to do it through My Social Security account, couple options. If maybe you can't do it through your My Social Security account because you're receiving from our needs-based program SSI, you can still go into your online account and get a PIN, so that you can call in with that PIN and be able to do it over the phone. If you're not able to do it either of those ways and you need to update your direct deposit, you will need to come into the office with a photo ID. Now, if you're not on benefits yet and you're applying for benefits, if you're applying for for disability, SSI, or Medicare only, you'll not be asked to provide your ID. And if you are filing for retirement, it's only sometimes that you might have to get flagged for providing an ID. So, everyone does not need to come in. Only in limited situations will you need to provide your ID to us in person. So those are great things to know. And then I said I'd show you a trick for the 800 number. Right further down on the main page, we have the Social Security performance link. So if you click on that, it'll show you different processing times you can check and 800 number performance data. So this is really nice because it shows you 800 number wait times. Now this I was on here at 11 and we had a wait time of 23 minutes, which I never see it down that low. We're now here at 1:48 p.m. The live data shows the current call wait time is 2 hours, 4 minutes, and call back time is 2 hours, 2 minutes. So we do recommend, if you can, calling in as early as possible when they open at 8 a.m. So that way you're on hold less, or you might get the callback option. And so you can go about your day and they'll call you back when they have time. But at a certain point of the day, they stop offering that callback option because of, they need to get everyone called back before the end of the day. So you can see too how many people are waiting on hold, 2,889, and over 25,000 waiting for a callback. And just in general, so I'm sure you've heard that we have a lot of staffing challenges and we're operating under less and less staff as we progress through the year. But fiscal year to date, so this would be October 1st through April 30th. Our 800 number served 42.7 million customers with an average daily call volume of 390,825. So that you can kind of see the reasoning behind those wait times with less staff. And you can kind of check here to see, is it a good time to call? Or if it's not an emergency, maybe I'll try again tomorrow morning. Other things you can learn about, scams, and if you have questions about my social security accounts. So one thing that changed with my social security is if you signed up before September 28th of 2021, you had a username and password. You were able to use that username and password up until recently still. But now it's requiring everyone to transition to either the login.gov or id.me accounts, even if you had that username and password for years. So this talks about those changes. It also provides a lot of troubleshooting for creating your personal account online or having questions about the different login ways. A lot of great information there. And then the final thing I kind of want to show you here, because we are in Illinois, this is something a lot of people have affected by. If you had a job where you did not pay Social Security taxes, previously you would be subject to, let's say you were a public school teacher and you had a TRS pension, but you also had worked odd jobs and had your 40 credits. You would have been subject to windfall elimination provision, which would reduce your Social Security benefit. Or if you have that non-covered pension and maybe you didn't have 40 credits, but you were married, your spouse's or survivor's benefits, those would have had government pension offset applied to them. Government pension offset reduces any potential payment by 2/3. But with January 5th of this year, an act was signed into law to eliminate the effects of windfall elimination provision and government pension offset. Estimated that this is over 2.8 million people who are not covered by Social Security because they didn't pay Social Security taxes that would have been affected by these provisions. Now, if this is your situation, you want to check out this page to see if there's anything you need to do. Now, if you're already receiving a monthly check from us, you do not need to do anything. Or if you're entitled on the record, even if you're not getting any payment, maybe you're in complete government pension offset, again, you don't need to do anything. I would recommend if you're not getting a check, you log into your My Social Security account just to make sure that your address and direct deposit information is correct. We started making the adjustments. They go back to January 2024 by law. That's the furthest they go back. Beginning February 25th, people started seeing these payments. Most people are going to receive, checks, as early as April, starting to receive that adjustment. But because of the sheer number of adjustments that have to be made, it's going to take up to potentially November to get all the cases done. So this highlights that. For many complex cases that cannot be processed automatically, additional time is required. We're releasing retroactive benefits and setting new monthly benefit amounts as we process each case with the expectation that all beneficiaries will be updated by November of 2025. So if you're on the record, stay patient and you will get caught up. But if you are not receiving a benefit yet, so maybe you didn't ever apply to be entitled, technically entitled on your spouse or former spouse because there wasn't anything due, so you just didn't go through that application. You will need, that's the case where you need to set up an appointment to file for that benefit. So in that situation, you would call our 800 number and go ahead and schedule the appointment. If you are past your full retirement age, we can go up to 6 months back for that retroactivity. So it won't go all the way back to January 2024. It'll go back by 6 months if you're not on a record. If you're on a record, the adjustment can go back to up to January 2024. So again, this page is a great one. It's got a lot more information than what I've touched on. So I do encourage you to check that out as well. And just go on our site, make sure you get your online account and check out a lot of other great resources we have.